your course in Cologne. I do apologize that I can't come to Cologne, but I will tell you some news and some basics about the different strategies in voice feminization. First of all, voice feminization has different aspects. Today we talk mainly in this lecture about the pitch. And there are differences between males and females with regard to pitch and with regard to the mean speaking voice range. And those characteristics for females and males are not fixed, they are changing by time as well. More or less you can say that the mean speaking pitch in males is about 100 Hz and in females between 170 and 200 Hz. And of course, if other people find that this voice sounds feminine or masculine, that not only depends on pitch, but many things which are produced in the vocal tract and in the prosody. But pitch is one of the key points that people accept that this voice is a female or a male voice. And there's a range in between the female and male speaking pitch, the ambiguous pitch range, and this is about 145 to 165 Hz. That means we should aim at least to come to 160, 170 Hz to have good chances to be acknowledged as a female voice. There are some theoretical thoughts about the different approaches to increase higher pitches. And that's why the targets of voice feminization surgery are the length of the vocal folds, the tension of the vocal folds, and the density or the mass of the vocal folds. And all the three aspects can be approached and they can be combined as well. So we end up as well with 2-factor or 3-factor approaches. And there are different models telling you what instruments you have to increase pitch by surgical means. And in this analytic continuum model, you see the relationship between the length of the vocal fold and the pitch. The longer the vocal folds, the lower the pitch. And you see the relation between the tension of the vocal folds and the pitch. The higher the tension, the higher the pitch. And in the center of the picture, you see the combination of the two factors, length and tension, and you end up in certain frequency corridors. Let's first turn to the different surgical approaches available. And the most famous one and most used nowadays is the anterior web glottoplasty or ventless glottoplasty. And this procedure clearly focuses on reduction of vocal fold length. The second procedure is the cricothyroid approximation, and this procedure aims at increasing the tension of the vocal folds. And finally, you have strategies to reduce the vocalis muscle density, and this is mainly the lava. And for all different approaches, we have data available, which tell us about the amount of pitch raise and the long-term perspective. This study by a group by Martel shows you that using the ventless glottoplasty, you will end up on average with a gain about 70 Hz in pitch. However, there are differences between the different age groups. You have better chances to have a proper increase of pitch when you are young, and when you were older, the chances that you make a big step toward the higher pitch are less comfortable. With regard to the cricothyroid approximation, introduced once by Ishiki, you see that this surgical strategy leads as well to positive results directly after the intervention. Again, we see results about 70 Hz. However, the experiences that in the long-term perspective you will drop back with regard to pitch because you have a reduction of tension in the long-term perspective. When you compare the cricothyroid approximation and the glottoplasty as done by Elena Mora in this study, you see this long-term effect very obviously. On the right side in this figure, this stable results with regard to pitch for the glottoplasty and the drop in pitch for the cricothyroid approximation. Let's finally turn to the laser-assisted voice adjustment, LAVA, and as well this procedure offers good chances to increase pitch. However, the effect is less in comparison to Wendler's glottoplasty and the cricothyroid approximation. That's why nowadays most of the surgical centers offer combined approaches, individual shape for each individual patient. And one very common combination as well used in our department is the combination of Wendler's glottoplasty and LAVA. And here you see data of a Finnish group by Ahmed Granate and colleagues, and these data show you that it works together. It can be done simultaneously or step by step, and you have to decide as a surgeon, is the combination of the two procedures worthwhile to be done. Finally, there are approaches around which combine all three aspects of density, tension, and vocal fold length. And one is described by one of the leading surgeons in the trans-voice surgery, Hyung-Tae Kim from Seoul. And he combines the vocal shortening, vocal fold shortening with the rate of displacement of the anterior commission and ends up with fine and stable results. And James Thomas includes a further step in his surgical procedure. This is the reconstruction of the supraglottal space in the same procedure as the vocal fold shortening. And this reduction of the volume of the epilaris tube, which is offered in that kind of operation, leads to a reduced foreign frequency of the epilarynx tube or resonance frequency, and this supports the feminization by means of an additional articulatory or sound component. So to summarize the results, as shown here in a meta-analysis for the glottoplasty, nowadays we have potential and safe procedures to increase pitch surgically, and most of the time Wendler's glottoplasty are used nowadays, sometimes with additional LAVA, sometimes not, and the cricothyroid approximation, because of the limitations with regard to long-term results, is a powerful tool, but just for special conditions, and we have to clearly decide which approach is the best for each individual patient. Now let's turn how we do it in my department, and of course feminization is a treatment concept. It's not enough just to see the patient for the intervention and transfer him to anybody else outside the department, but you need to have close contact, because the voice feminization is one part of an entire stepwise procedure of feminization. And your patients have to see that you understand the entire way, and that you follow up them to see the long-term results. So as many of our patients come from outside our city and outside the country, we usually start with a video consultation. And of course, we ask if the patients have had voice therapy or not. And most of the time we do like a reinforcing of the voice therapy issues, really to be sure that the patient really has addressed the entire functional capacity of the voice system. And keep in mind, it's not just pitch which makes a feminine voice. It's much more. It's acoustics, sound, it's prosody. So most of the time we follow up this additional voice therapy step and monitor that and look if the patients reach the intended result or if they do not. And if they do not, we apply for cost coverage at the health insurance institutions, and we go to plan the operation. And as I told you, we offer a setting that we treat the patients, including voice therapy, 3, 6, and 12 months post-operatively. We have support by different things. We have support by groups who are organized with supporting each other if you have the same issue. We have technical applications like Friends Voice Analyzer, where you can check your feminine or masculine status of your voice. And finally, then most of the time we first run with a Wendler glottoplasty. As you might know, Jürgen Wendler invented the glottoplasty in the 80s of the last century. And the intervention starts, I'm sorry, I go back, and now let's see. The intervention starts, and this is speeded up to save some time, with a de-epithelialization of the anterior commissure, the anterior part of the glottis. And it's not just the epithelium, it's as well the subepithelial tissue, but we keep the vocal ligament and, of course, the vocalis muscle in the right position. The procedure includes as well the mobilization of the mucosa in the anterior commissure, and then the procedure depends very much on the proper position of the sutures. With the anterior suture, you try to reach a lateral position to bring as much as possible muscle in the midline together. For the posterior suture, most of the time, if you're successful, go a bit more medially to really adapt the cutting edge of the epithelium from the left or the right side. So most of the time we use 2, sometimes 3 sutures, and we use Vicryl. This can be done as well with non-resorbable sutures. This is not the main point of the strategy. Okay, the ventiloplasty is most of the time the first step. Sometimes we combine it with the lava. There are cases we do it in the same procedure, and there are cases we do it in a different approach. And in the lava, you do a CO2 laser-based incision at the lateral part of the vocal fold, and you go as deep as you reach the vocalis muscle, and you have to reduce the vocalis muscle. In rare cases, if you need to adapt the edges, but most of the time that works without sutures. Let's listen to an example. What is a typical prospective result, or what are results which can be reached with a glottoplasty? Here we talk about a 21-year-old lady. So this is a preoperative assessment, and this is a preoperative voice.
Der Nordwind und die Sonne. Einst strichen sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre, als ein Wanderer, der in einen warmen Mantel gehüllt war, des Wegs kam. Sie wurden einig, dass derjenige für
4 months after voice therapy, so without any intervention, initial voice therapy, the voice sounds like this.
Der Nordwind und die Sonne. Einst stritten sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre, als ein Wanderer, der in einem warmen Mantel.
So you realize it was not just an increase in pitch, it was as well an improvement in the prosody and in the feminine structure of the voice. And finally, the voice after glottoplasty.
Der Nordwind und die Sonne. Einst stritten sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre, als ein Wanderer, der in einen warmen Mantel gehüllt war, des Weges kam. Sie wurden einig, dass derjenige für den Stärkeren gelten sollte, der den Wanderer.
Well, let's turn to a second case. A patient with an initial glottoplasty followed by lava, and you see, or you can listen to the stepwise change of the voice. First, the initial voice assessment.
Der Nordwind und die Sonne. Einst stritten sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre, als ein Wanderer, der...
Then after the glottoplasty.
Der Nordwind und die Sonne. Einst stritten sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre, als ein Wanderer, der in einen warmen Mantel...
And the patient felt this is not enough, so we did an additional lava in a sequential way.
Der Nordwind und die Sonne. Einst stritten sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre, als ein Wanderer, der in einen warmen Mantel gehüllt war, des Weges kam.
And here you can hear that it's not only pitch, also the registration of the voice has changed. So the lighter parts are increased and the lower spectral parts are changed as well, though you get a more lighter impression of the voice. Finally, let's listen to a case with Glottoplasty and Lama Serotelis.
Der Nordwind und die Sonne. Einst stritten sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre. Als ein Wanderer, der in einem warmen Mantel
And after surgery.
Der Nordwind und die Sonne. Einst stritten sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre. Als ein Wanderer, der in einem warmen Mantel gehüllt war, des Weges daherkam. Sie wunderten, dass derjenige für den Stärkeren gelten sollte.
So, to summarize these approaches, the options to have the traditional dentless glottoplasty, to have on its own or in combination with the lava, has increased our instruments to counsel in the right way and recommend the patient the best fitting surgical procedure. If you are interested in the history of ventless glottoplasty, then you can listen to our homepage where Jürgen Wendler gave an interview about his first steps in glottoplasty. And on the homepage you can find as well some further examples and information for the surgery. I thank my colleagues Alexander Meindler and Mario Fleischer, who contributed substantially to the presentation, and I thank you for your attention. Bye bye.